Hi, my name is Abraham Moscoso, and I will talk about a myocardial infarction in the context of an acute infection. So we will see a video first. And what is an acute and myocardial infarction?
Acute myocardial infarction is acute closure of the coronary artery, which is related to either rupture of the plaque, leading to acute onset of thrombus formation and sudden arrest of blood supply to that area, which is defined as ST elevation myocardial infarction. You may not have chest pain in certain conditions. Majority of the time you will have chest pain, but there are certain variables like advanced age, diabetes, they may not have chest pain. Woman heart attack usually presents as an atypical symptoms, which may be a variable from the normal chest pain and can mimic different conditions. Like they can present with neck pain, epigastric pain, and different variants of the chest pain which are not typical of angina. Aortic stenosis usually presents in two forms. Either it can present because of the degenerative aortic valve disease from advanced age, or it can present from congenitally malformed aortic valve. Usually it's a tricuspid valve. If you have bicuspid valve, it's more prone to degeneration faster, and they present a little bit earlier part of their age, of their life, with aortic stenosis. So patients with mitral stenosis, they usually have underlying history of mitral stenosis, especially have underlying history of rheumatic heart disease. So more commonly seen, which has become less and less. And other conditions for mitral stenosis are very rare to happen. Mitral stenosis can be caused by, you have other patients with renal failure, patients who have left atrial myxoma, they can cause. These are the other conditions which are commonly seen, and degenerated mitral valve from advanced age that can also cause mitral stenosis.
So we will talk about the definition. The acute myocardial infarction has two types. The type 1 myocardial infarction is defined as myocardial ischemia that is caused by acute coronary occlusion related to atherosclerotic plaque disruption and superimpulsed thrombosis. Type 2 myocardial infarction occurs when the metabolic demands of myocardial cells exceed the capacity of the blood to supply oxygen to the cells, phenomenon commonly referred to as demand ischemia. We will see a video.
To feel chest pain, very intense, oppressive, and sweating, immediately go to the emergency room. If the pain lasts more than 10 minutes, and it is in the area between and the happen and never, it can mean an acute myocardial infarction.
40% of people die in the first hours after a heart attack, not receive immediate medical attention. An electrocardiogram can be vital. This exam is the best option to confirm or discard an attack.
Myocardial infarction is the closest arterial part of the heart not getting enough blood supply. It occurs when a coronary artery is blocked, or the decreased blood flow to the heart muscle. The blockade occurs when cholesterol and other substances
Infiltrate the interior wall of an artery, forming an atheroma. This plaque grows and increases slowly for decades. Some are unstable and break.
When this plaque breaks fast and it forms a clot, a events broke the artery completely, and longer it creates more blood. We are facing a heart attack.
The most effective treatment is the realization of a primary angioplasty. With an implant stand this ungloved, the artery and blood flow again become functional.
When recovered, the comital months by will rise time regularly comes with the doctor and follow the treatment, healthy eating, rich fiber, no fat, and regular exercise.
You can make a big turn to a healthy heart.
Well, applications in medicine. A meta-analysis of 5 randomized trials showed a 36% lower risk of a composite of cardiovascular events among adults who had received influenza vaccine than among those who had not. This shows that there is less risk to have an acute infection and die from that event. Also, there are other improvements like the implementation of new drugs to treat the disease. We'll see another video.
The most common cause of death in developed countries are cardiovascular diseases. And out of cardiovascular diseases, coronary artery disease is the most prevalent. The heart is a muscle that is pumping the blood every day, every single second. And in fact, it's pumping more or less 7,000 liters per day. It's beating more than 100,000 times per day. And all this cardiac function is done because the heart itself requires oxygen, requires the necessary food or the necessary nutrients for doing its function. How the heart is receiving this oxygen is via the coronary arteries. There are 3 main coronary arteries that supplies oxygen to the heart in order to keep its function. An infarction is when one of these coronary arteries is occluded. What happens then is that since the artery is occluded, the heart is not receiving the necessary oxygen for its proper function. So if you don't receive food, if you don't receive oxygen, then that part of the heart is going to die. It's going to be what we call necrotic. And this is exactly an infarction. So an infarction is the result of an occlusion of the artery that implies that a certain amount of cells, of heart cells, are going to die because they are not receiving the necessary oxygen. This is an infarction. And
first sign was a bit of chest pain, just like indigestion really, which is something I've suffered from before, so I thought I'll just stop a minute. And then I started to come out in a sweat, such that it completely covered my t-shirt. I sat down on the floor and my energy started to go, and there was nobody at home, it was just me. It was quite frightening because there was nobody to ask, and 999 is a number we all know, but we all hope we never use. So it really was a tough call to make a 999 phone call.
One of the problems we have is that the expectation that patients have about a heart attack aren't actually the same as what they experience when it happens. Occasionally people have the Hollywood heart attack, the sudden severe chest pain that sort of knocks them for six, and they're doubled up in agony. But to be honest, most people have a much more sort of vague presentation where the pain is maybe less acute to start with, maybe builds up gradually. The patient's expectations are to some extent preventing them from calling for help because they can't believe that these less dramatic symptoms are actually a heart attack.
And it got to the stage I couldn't actually move. I just didn't have the energy. The paramedic came in, he reassured me, started doing some tests, then the ambulance crew arrived. He passed all the information to them. They did a bit more work on me, and I was in the ambulance then on the way. There was somebody sat beside me who was talking to me all the time. She was telling me that the information they had was already being relayed to Derriford Hospital, so that would save time on arrival. I felt really reassured.
The treatment of acute heart attacks has improved very substantially over the last 5 or 10 years in this country because we now have a system where nearly all patients are taken straight to the cardiac catheter lab for primary angioplasty, and that means a treatment where we open up the artery with a balloon treatment, and then that can restore blood flow to the heart muscle as quickly as possible.
I came
According to the World Health Organization, cardiovascular disease is the leading cause of death worldwide, as well as in the US. Of those, a large proportion are caused by heart attacks, also known as acute myocardial infarctions or just myocardial infarctions, sometimes just called MIs. The word infarction means that some area of tissue has died due to a lack of blood flow, and therefore a lack of oxygen. Myo refers to the muscle, and cardial refers to the heart tissue. So with a heart attack, or MI, you have a death of heart muscle cells because of a lack in blood flow, a process called necrosis. Now the heart's main job is to pump blood to your body's tissues, right? Well, the heart also needs blood, and so it also pumps blood to itself, using the coronary circulation. The coronary circulation is the system of small arteries and veins that help keep the heart cells supplied with fresh oxygen. Heart attacks happen when these small arteries become blocked and stop supplying blood to the heart tissue. And if this happens for long enough, heart tissue dies. Almost all heart attacks are ultimately a result of endothelial cell dysfunction, which relates to anything that irritates or inflames the slippery inner lining of the artery, the tunica intima. One classic irritant are the toxins found in tobacco, which float around in the blood and damage these cells. That damage then becomes a site for atherosclerosis, a type of coronary artery disease where deposits of fat, cholesterol, proteins, calcium, and white blood cells build up and start to block blood flow to the heart tissue. This mound of stuff has two parts to it: the soft, cheesy textured interior, and the hard outer shell, which is called the fibrous cap. Collectively, this whole thing's ominously called plaque. Usually, though, it takes years for plaque to build up, and this slow blockage only partially blocks the coronary arteries. And so, even though less blood makes it to the heart tissue, there's still blood. Heart attacks happen when there's a sudden, complete blockage or occlusion of a coronary artery. So let's see how that can happen. Since these plaques